Good evening, everyone. Welcome to the Financial Inclusion Week 2021 webinar on designing for sustainability during emergencies and discuss the lessons from COVID. Today, we will explore how digital financial solutions that we tested during the pandemic may become the vehicle for long-term sustainability and system strengthening in the future. So by end of this hour, we hope to have heard from our speakers and everyone in the audience on how we can take the best of what we have learned in responding to the pandemic and extend that to the sustainable solutions responding to future challenges. I'm Munmun, working at BRAC Microfinance. BRAC, as many of you know, is the largest NGO in the world. It was born in Bangladesh in 1972 and expanded into 10 other developing countries across Asia and Africa. It spreads anti poverty solutions, making it a global leader in providing opportunities for the world's poor. So, what do we mean by designing for long-term sustainability? So, while doing so at BRAC during the pandemic, we kept few things in mind. One is that identifying barriers and designing solutions to overcome it, identify the challenges during implementation, and innovate to address the issues. Third is minimize supply side pitfalls. Inclusion is key, so we have to ensure that everyone have access to the services. Lastly, problems will arise in projects. We have to plan for solutions that are local. So let me walk you through the agenda that we have for the webinar today. First, my colleague Raya, she will give you a rapid overview of the DFS innovations during the pandemic. Then we have three breakout room sessions, which will run simultaneously. So the first one is on strengthening systems with financial inclusion to prepare for future innovations. Here we have speakers. We have Samantha Faranas, Program Manager at Skills Development Program. We have Tanjila Mujumdar Drishti, Senior Manager working at Health, Nutrition, and Population Program. And the third speaker we have is Wahid Newton. He is working as the Senior Program Manager at Education Program. And the other breakout room session is on the future of financial health and inclusion. There we have Tanvir Thali, Program Head at Microfinance Program, and myself as speakers. And the third breakout room session is on targeting new challenges with frontier technology in financial inclusion. Here, the speakers are S.M. Mahmoud Zaman, who's the Senior Program Manager at Ultra Poor Graduation Program. Then we have Kuldeep Aryal, Technology for Development Specialist at Social Innovation Lab. And last but not the least, we have Mojibul Haq, who's working as the Program Manager at the Urban Development Program. So please feel free to join any of the breakout sessions that is of interest to you. And in the breakout sessions, you get to share your experiences as well that you had during the pandemic. So before I head towards the breakout room sessions, I would like to hand over to my colleague Raya for a high-level rapid overview of BRAC's COVID-19 innovations in digital financial service. So Raya, over to you.
So before moving forward with the future goal of our session today, I'd like to share some examples of how digital financial inclusion may have transformed our response to the pandemic across sectors. So we believe that these changes are telling of how much more collaboratively we can work together across sectors in the coming decades. When Bangladesh went into lockdowns in March 2020, we needed ways to deliver essential services remotely. Schools were some of the first to be affected. BRAC's 25,000 teachers reach millions of children through local classrooms, but their interactions in-person communication. So we needed quickly to reduce the learning loss that we're seeing daily. Our teachers began taking classes over the phone supported by mobile money based payroll system that we had invested in several years ago. The mobile wallet payroll ensured teachers had access to financial support at their fingertips, and the program was also able to make changes on the go. We faced also a similar challenge with our 45,000 community health workers or volunteers who took on the huge task of going door to door to share life saving information. Connecting them to a mobile money based payroll ensured that they too had the right support at the right time. However, given their digital literacy was much lower than others, we also needed to invest in onboarding them to access rapidly and build an ecosystem of support around them so that they felt confident and in control. In microfinance, we opened digital payments for all of our BRAC's branches across the country. For the first time, our clients were able to go where they could to find work and still access microfinance support. And we devised simple protocols for the transitions, including a mechanism to track payments since we didn't have time to build a unique ID system right away. Finally, digital financial services, and in particular mobile money, has helped us reach vulnerable populations timely and directly. BRAC sent digital cash transfers to over 900,000 families during the pandemic, and our staff supported local agents and shopkeepers to encourage more mobile money transactions so that agents and clients could retain funds safely um, within the app until the moment of spending. So, along with that, one way to directly incentivize behavior change using mobile wallets was by connecting our food assistance program for the COVID affected urban poor to mobile money payments. Beneficiaries could use the food vouchers sent to their mobile wallets to purchase anything they needed from participating from a participating store, but they were provided information on nutrient rich ingredients at home and at the point of purchase, and they were given a mobile cashback bonus when they used the voucher toward suggested items, and this proved highly effective. More specifics on our experimentation and lessons learned are shared in a collection of case studies that we will put on the screen shortly. This case study series is BRAC's innovation with DFS during COVID-19, and we invite you all to have a look. Thank you very much, and I apologize for the technical difficulties. Back to you, Munmunapa.
Thank you, Raya. No worries. So now we're going to go to the main session, which is we're going to head towards the breakout sessions. Once again, what you need to do is click on one of the three sessions that you want to join, and then we're requesting you to participate for an interactive conversation. So can we just move to the breakout room sessions, please?
Okay, great. I think we'll start off. Is that okay with you, Drishti Abbu?
Yes, and when Newton Bhai joins, he can continue from there.
Okay, great. I just want to respect everyone's time and keeping track with the clock. Once again, a very good evening to everyone here. I'm honored to be here with you today. I am Samantha. I'm a program manager for business development at the BRAC Skills Development Program. Also with me today, I have here is one of colleagues, Tanjila Drishti, who is a senior manager at the BRAC Health, Nutrition, and Population Program. We are also waiting for another colleague of ours, Wahid Newton, who is a senior program manager at the BRAC Education Program. So I just want to kickstart the panel discussion. Uh,
Newton
we're
Bhai
going
is
to
here.
see. Oh, great. So Newton, I've already started with the opening remarks, so that's great. So going right into it is that what we observed during the pandemic is that we've seen how innovative financial tools support rapid responses across the nation. And during this time, we saw an upsurge of digital financial digital payment services, especially mobile financial services like Bikash. Um, but what the pandemic also shed light on is the need for more and better financial instruments to support overall system strengthening, recovery, and bringing the overall economy back on track. So, for this panel discussion, what I'm going to do is first, I would like to give the floor to my colleague Drishti, as she is part of the BRAC's health program. And they were amongst the first responders in the crisis. So, we'll learn a bit about how they utilize different financial innovations during that time. So, over to you, Drishti Apu.
Thank you so much, Samantha. I just wanted to quickly check, am I audible? All right, thanks, Maliha, for the nod. So I'll start off with a little bit of flashback. Year 2020, COVID-19 hit the world, and we saw how institutions and systems fell apart globally. Bangladesh was no different. One fine day, we were forced to begin the process of unlearning the regular way of doing things and find new ways of surviving and sustaining. This was true for people at all stages and organizations of all sorts. Now, it is truly unfortunate how the health system across the globe were getting choked to tackle a global pandemic, yet very little importance was given to the challenges faced by health workers while they continued serving the community. BRAC's community health workers went through their share of struggle as well at the very beginning of the pandemic. Now, to give the audience a little bit of context and background about BRAC Health Nutrition and Population Program is the hub to the world's largest non government community health worker network. Our 50,000 trained health workers and volunteers cater to healthcare needs of 110 million people across Bangladesh. For households based in remote and marginalized communities, these community health workers act as the primary source of reliable information for healthcare. In a lower income country where out of pocket health expenditure stands at a striking 74%, more than 5 million people are pushed back into poverty each year due to unforeseen catastrophic health expenditure, and doctor to patient ratio is far from WHO's recommendation. Community health workers play a crucial role. On top of the need of these health workers, what adds on to the acceptability of them is the fact that they are women from within the community. And when I say women from within the community, not just females, but they are women between the age of 40 to 55 from within the community. So any information, the context and the cultural context of global south, most of the countries in global south and specifically in South Asia works in a way that any information or advice coming from these community health workers is rather accepted like an advice from an aunt next door who is experienced in the matter. So whereas them belonging to the community adds on to their acceptability, but this also means that like their beneficiaries, they also belong to lower income households. So in light of the pandemic, this meant the economic shock that happened was as harsh for their families as it was for the households in their neighborhood. In early March 2020, BRAC trained all its 50,000 community health workers and volunteers to go door to door and orient people living in urban slums and rural villages about life-saving information on COVID-19 prevention. The scale of the rapid mobilization was such that within only a span of 10 days, more than 5 million people were reached with life-saving information. People who otherwise would not have the knowledge on how to safeguard their families from this deadly virus that was on the loose. Our community health workers not only built an emergency mass awareness nationwide in the most deprived areas, but also ensured that crucial life-saving services such as maternal health care remains available to those in need. Adapting to the new normal was challenging for these women. However, the real struggle arrived when the nation went into lockdown, disrupting systems ranging from transportation to physical banking services. Our community health workers were no longer able to receive payment for their work. This essentially meant that they were out on the ground, giving service to the community, really being there for the community, catering to the healthcare needs. But back at home, their families were suffering from a financial crisis. We were forced at BRAC Health Program to find an alternate way of paying them. thanks to my colleagues in BRAC Health Program, BRAC Technology, BITS, and Bikash, within a span of only 25 days, a new payment method, a whole system was in place, up and running. 43,000 middle-aged women within a span of few weeks living in urban slums and rural areas now had a digital wallet and knew how to use mobile money. I mean, it might not sound as as big of a milestone, but for people who have worked in the South Asian context or have parents of of the age range that of our community health workers would possibly be able to relate on how people with no previous exposure to digital literacy or digital financial literacy suddenly getting on board to this the concept of virtual wallet and mobile money and trusting this system to get their money. It was a big milestone. Like I said at the very beginning, we were forced to unlearn the regular way of doing things and find new horizons. Now, what does this mean for the future of community level healthcare payments in Bangladesh? At BRAC Health Program, we right now stand at an exciting crossroad of opportunities where now we are exploring if perhaps we want to empower a big chunk of our health volunteers to become health micro entrepreneurs within their community who would accept digital payments from their beneficiaries for basic healthcare commodities at the doorstep. This could also mean these women who have such high acceptability within their communities are perhaps also now in the best position to teach their beneficiaries how to use mobile money, what are the benefits, and how they can trust this platform. Promoting financial inclusion at grassroots level through community health workers may sound a little unusual. Is it really that unusual, though? I leave the floor with this question, looking forward to questions, comments, and examples of similar work from the audience. Thank you.
Thanks, Drishti Apu. That was a very insightful look of how our first responders were responding during the pandemic. Now, what we are going to do is hear a bit from the BRAC education program. Some of you might be aware that Bangladesh was amongst the countries that observed one of the longest school closures during the pandemic. What we're going to hear from Newton Bhai from the BRAC education program, how the program utilized financial solutions to address some of the pressing issues related to the prolonged school closures during that time. Newton Bhai, over to you.
Hi, you are on mute.
Unmute it. Yeah. Now it's okay.
Yes.
Okay. Thank you. Sorry. Welcome everyone. This is B.A. Wahid Newton working in BRAC education program. As you know, business as usual changed dramatically in 17th March 2020 when government of Bangladesh closed down all the education institute in Bangladesh due to pandemic. Immediately, we started exploring the scope of engaging students in learning process as part of the education continuity plan at national level with stakeholders who are working in education sectors. And we jointly try to identify how quick we can start some initiatives so that the students remain engaged in education initiatives, and identify 4 platforms where we can contribute, where we can start initiatives and reach to the students. And these 4 platforms were one is television, second one was radio, third was internet, and fourth was mobile network by mobile phone. We supported government of Bangladesh to start a very pilot initiatives to broadcast television program to air the lessons for the primary and secondary grade level students in March 28, 2020. Just remember, after within 11 days, we are able to identify a solution which can engage student in learning process. That was because we had some content which was almost ready to air in the television. At the same time, it was for the national program. At the same time, we started exploring scope available for our students, our BRAC students, as they are mostly from the last miles and marginalized communities, and almost 150,000 students of BRAC schools were at grade 4 and 5 level. And in our country, if you have some understanding about our socio-economic situation, the students who are in grade 4 and 5 are most prone to drop out due to different economical and social issues. So we had the hunch that if we don't continue if we were not able to start any educational institute for the students of BRAC schools, they may at high risk to get dropped out. And at the same time, there is a high scope of having learning loss, greater learning loss, as they don't have different second options. They only have the options to learn from the teachers and from the schools. So we have to find out a solutions for them, and we started identifying what we can do. At the same time, we started exploring what scope they may have. We find out that only 16% of our parents have access to the television programs which was aired by the government. And and uh, um, and at the same time, the good news was that we identified that 92% of our parents have mobile phone at their home, and they were interested to allow their kids to access that mobile phone for educational purpose if we have any initiatives. So these two indicators help us to uh, identify a model so that we can immediately start our education initiatives, business as usual, through phone, so that students remain engaged in education system. So what we did, we had, as our previous speaker said, we have in BRAC, we have a greater ecosystems in terms of mobile money. And with the support of our social innovation lab and Bikash, we started paying teachers honorarium through phone since 2017. So that platform helped us to send money to the teachers to buy their airtime so that they can start communicating with the parents through and the students. And the way they can engage students in learning, provide some psychosocial counseling, and at the same time also some well-being initiatives, so that students are remain engaged in education and also can learn the new concept, new words that have started in the new world. That was like, so what is social distance, what is hand washing, and why we need to wash for 20 seconds, and why we have to wear mask and maintain keep ourselves in isolation, isolated in the class, in the house. So these were the things which really was great concern for us. And we the platform that we had, we could manage and start our new initiatives within April first week. So within 15 days, we were able to identify a model which helped us to keep students engaged in education initiatives. And now we can see that, as you know, the school are now open, and in national systems, as informal statistics say, there is almost around 50% dropout in education in other institutes, but in BRAC it's almost 3%. So our that initiatives helped to keep the students engaged in learning process who are mainly from marginalized communities. And thanks to uh, the initiative that we have taken earlier, which really helped us to build on our experiences. And this we also trained our teachers, our staffs, how to use that new models. And teachers also used to recharge their talk time through the money that we have sent, and they were able to communicate with the students and parents and to keep them engaged in learning. And I will be stop here and will be waiting for the questions from the audience. Thank you.
Thank you, Niton Bhai. Thank you so much. As you can hear, that all of the programs in BRAC have more or less utilized mobile financial services, Bikash, for various money disbursement purposes, whether it was giving emergency cash to households, to paying salaries for our different workers in the field and at the head office. So from the skills perspective, what we have done, yes, we have been involved in the emergency cash disbursement. And I would also like to indicate that we had a financial microfinance loan that was given to some of our entrepreneurship development graduates. What they availed the Unmesh loan of the microfinance institution, and what they were able to do is that they were able to use 2 vouchers from this specific loan to extend the repayment timeline. So this helped their businesses stay afloat during that crisis point. But from the BRAC skills development program, and I think other programs, especially BRAC education program, what has become evident is that there is need for more and easier access to credit. I'm sorry, it's not just from skills or education, I'm sure from health too, but there is need for more and easier access to credit for various purposes. And speaking from the skills and education point of view, I would say is that what has become evident during the pandemic is the huge digital divide that lies in Bangladesh between the different classes of people and even between the genders. Like, for example, we've seen that the digital divide is far greater, especially for girls and young women. And in this new day and age, now it feels that uh, owning devices ranging from smartphones to a basic laptop, it is essential for maintaining a basic livelihood. So whether one wants to enable their infants or their children to doing classes online, or even operating their e-commerce or f-commerce based business, you need to have a basic device at home. So on this note, what we have done is we are now working with the BRAC microfinance to scope out how some of their other microfinance loan products like Dabi can be used for purchasing phones or devices that are essential essential at this point. And it's not just about what we have also seen is that it's just not about developing new products. We also need to communicate and inform people on the what's and the hows. So there is need for developing effective communication and awareness building strategies to ensure that the target groups are well informed, are able to access the different financial instruments, and are able to benefit from them. So with respect to time, I know we have touched on some very critical points, and I'll open the floor to questions right now. Thank you. Thank you to all my distinguished panelists.
So far, we haven't had any major questions that most of them has been answered. So, given the time shortage, I think we have much time, so participants needs to start moving into the main session. But before that, any ending remarks on how do you see the future of sustainability in the future programs? So maybe you could share your insights on that.
So I'll start off with that. My view is that we have now, it's more evident that, you know what, in today's day and age, there is no longer a fine line between digitalization and financial needs. These have been married, and these need to be communicated at different levels. Like, it's no longer secluded to the upper or creme de la creme of the economy. And we completely understand that and acknowledge that. And from the skills perspective, what we have done is that we have embedded financial literacy into each and every one of our skills training, because it is so important. And we are also ensuring that we are constantly in touch with microfinance and the government and financial institutions to start working on developing more innovative and sustainable financial solutions. So I'll hand it over to Drishti Appu now.
Yeah, I was really hoping that we would get to hear from the audience about their thought and, if they have done anything similar. Um, uh, Unfortunate that we are unable to do that. For the way forward, I essentially think that it is time that, in terms of system transformation, we need to stop working in silos. Like, like, for example, financial inclusion is a financial sector problem, health inclusion is a health sector problem, skill inclusion is a skill sector problem, or so forth for education. There are certain things which are interdisciplinary, and I think it's high time that financial inclusion essentially starts being treated as something that's
And work, uh, what worked well for us in the pandemic during the COVID response and what didn't. Can you please start off the discussion with that? Thank you.
Well, thank you, Mamun. Very timely conversation because we all know the impact of COVID-19 across the globe, and nothing so different for Bangladesh. So COVID has had different impact. When we had faced the lockdown, then at that point of time we had a different kind of impact. In the post-lockdown situation, we had a different kind of impact altogether. So uh, actually, what we have seen during these 2 years and different phases of COVID impacts, lockdown, post lockdowns in two phases, we wanted to actually leverage the strength of BRAC microfinance program that we call always say like microfinance is a human interaction with our clients. So we first leveraged those kind of platform, and when the COVID hit in back in 2020 March, so we started our awareness program, health awareness program, because that was the most important piece of information that was required to disseminate to our clients, because there are many false informations coming up and they're actually looking for some authentic source of information. And BRAC actually played the field team of BRAC actually played a very important role in disseminating the health awareness information, and that actually helped eventually to actually keep a close tie with our clients to get their economic information, how they are actually passing their days during the lockdown situation. And that has been BRAC doing for so long. Client centricity, or you talk about the client situation analysis and understanding of a client's economic health. From that point, we actually see different challenges are coming to the lower income population of Bangladesh, and one pretty much is like the food security problem, because of long-term lockdown problems. So we quickly understood the problem of our clients, and the best part that I would say, like BRAC has invested heavily on how we can really keep a close tie with our clients by introducing additional mobile allowance to talk with them on a regular basis, going to their households with COVID awareness information, and also getting those updates from them about their economic health and everything. So uh, when we saw that they are facing these food security problems, so we started introducing those digital platforms that was required at the time because movement was so restricted nationally. So as our field team had electronic devices for like 3 or 4 years, so we quickly uh, worked with our partners, mobile financial partners, and we launched these digital platforms so that they quickly withdraw their savings, and BRAC also disbursed cash grants to different funds to our most vulnerable, and that actually possible through this digital at that point of time. Uh, Next, I would say like what really well is actually once we see like what was the real demand of our clients once the lockdown actually ended and they faced a different situation. So we see like they need money, and they need time extension to repay their arrears or their loans. So what we did, we like introduced few flexible products line and we introduced refinance, we introduced rescheduling of our loans, and that actually helped the clients to actually, uh, uh, you know, based on their cash flow, they can actually, you know, have a more sync with the financial transactions with BRAC. That is more or less, I would say, like what really went well. In terms of what didn't work, actually, I want to rephrase this like what could have been more better, because we have tried many novel things. Also, government tried many things during this is so new challenge for us, so uncertain challenge for us. So we had to try out many things, and government was also trying out many things. But I would like to say like one really eye-opening experience that we had is actually really looking into the product line product that we have, like 1 year loan with a monthly fixed repayment system. I think like now the situation is like that. Really think about how we can transform from that product to more cash flow based products for our clients to meet their needs. This is number one. Second of all, what could have been better is actually when we look into the stimulus packages of government and many initiatives that they tried out to actually support the lower income population. We see very little information was there to actually really understand the integrated economic health of the population after COVID hit. We saw the economic growth. We had an economic growth, but there was a total economic growth. But the real economic growth of the lower income population was actually not in a good shape. So that indicators, I think, is most important to look into when you really design some kind of stimulus package for the low income population that will really help them to cope up with this mechanism. Yeah.
Okay. Great. Thank you so much. I think another important question after hearing from you, arises in my mind is that with increased digitization, as you said earlier, how we use digitization as a tool in the pandemic, what are some of the concerns regarding the future of financial inclusion that you can just let us know briefly what you're thinking in this regard?
Uh, I don't see actually any concern with digital interventions and increasing digitization will have concern for financial inclusion, because I see this is the way in future for financial inclusion. This is one of the very important way to do it. Uh, what I see is actually a change in client interaction, a change in client behavior, because you know that microfinance heavily relies on group based models, and once you if you see the transformation of you know uh, group lending model to self-help group lending model, there then and there we saw a transformation happen within these group meetings and group models, and more and more we were seeing like this cohesion among the group clients was actually weakening, and more we are relying on individual service delivery, individual transactions and everything. And I see like when these digital interventions will come in, more clients will prefer to do their transactions not going to the delivery points, rather in their home or staying in their preferred zone. So I think the client interaction model, we have to really think what will be the future client
Absolutely.
interaction points once client will be more and more will be interacting with digital ways.
Absolutely. Totally agree with you. This is something definitely we should think about. So in the audience who are here at the moment, do any of you have similar experiences in your organization? Would you like to share something with us? If not, then I would like to know more from Tanvir Pai. So another thing that I was wondering that how might we focus on long-term financial health and stronger community support as part of the sustainability plan, since this is what we're talking about in the webinar today. Would you mind sharing your thoughts on this as well?
Yeah, I think this is what every microfinance institutions globally currently is thinking about it. Being a large microfinance institution or a small or medium, everyone is actually trying to get those things right to actually make their future more sustainable. And uh, here we have to like really become very patient. I know COVID has a huge impact on our clients and their financial health, and also had a large impact on the financial sustainability of the microfinance institutions. So uh, this is like evident, and this has happened like 100 years. When the last Spanish flu happened in 1918.
Right.
So, uh, so we have to be very patient and really have to look into what our clients are going through and what they really want and what they really need to coming up from this their challenging situation or recover from this COVID impact. So first of all, I would like to say like financing is a very strong tool, and it has proven to be the most strongest tool to actually cope up any kind of crisis. So saying earlier, like one size fits for all, the straight line product, we have to really come out from those and really think about how we can support our clients with more and more customized solutions like cash flow based products, like seasonal loans, maybe consumer loans, maybe job holder loans,
Like
designing
more
products
customized products that you're
more
talking about.
customized in line with their cash flow or income flow, that we have to think about. Number one, uh, we have seen a different group of poor has emerged from this COVID, and we call them the neo poor. And this new poor actually requires a different kind of financing options because these poor were not poor previously, and their profession has got changed, their location has got changed. Maybe they have migrated from urban to rural or rural to urban. Their profession has changed because there was a job cut or they have a devastating loss in their enterprises. So we have to really work for those new poor group with more understanding of the right financing solutions. And beside financing solutions, we have to really work on how to upskill their skills so that they can really perform in their new profession and they can earn much better, or at least at their previous earning level. So this is number one I'd like to mention. Number two is actually we have always experienced that savings has played a very important role. And during this week, we have seen like those clients who had good savings, they could really, you know, had a good
Come out
resume
of this.
during this lockdown situation. And we have to leverage this platform more and more so that our clients can really overcome any future crisis like COVID or any other crisis they face in future. Number three is actually I would like to leverage the point of the digital literacy and this digital, because more and more we are seeing like digital interventions are playing an important role in financial inclusion, in managing lockdown. This has been very effective solution, uh, and our clients are the clients who had the lowest literacy rate, the lowest understanding of digital devices and how to manage those applications and platforms. So we have to really focus on digital literacy to actually help them to ensure their transactions are happening in the right way. They're feeling more confident, not having any of digital platforms. And number two, we're seeing like digital way of doing business is becoming even for the cottage enterprises, be it in rural or be it in urban. So any business future coming up, digital way of doing things, a integral part of their business. So we have to like really train our on digital literacy, how to do business in digital, how to do transaction in digital. Uh, there are other few points. If I just go quickly, like there was a huge drop of income level during and the post-lockdown situation. What we have seen that the income level drop was mainly due to the male counterpart has dropped. Maybe their job has been lost, they have lost their job, or their enterprises has faced devastating shock. We see an unique opportunity to really utilize the 50% of our population, or the women, to make them more productive. For a long period of time, we have seen like our women who are actually trying to build some enterprises, they're mostly confined to micro and cottage enterprises. Time has come to really think about how these micro and small enterprises can be converted to small and medium enterprises with more and more women entrepreneurship, and offering them more, women friendly products and training for them. So if the women can come more to the economic contribution, I see this financial health of the lower income population is going to increase along with their male counterparts income. Last but not the least, I want to focus on like, uh, we have to really work on as an agent of financial advisor rather than agent of, only doing financial transaction. We have a huge pool of resources. It's a high human intensive sector that we work on, and these resources, field resources, has we need to really work on their capacity so that they can really work on how to ensure, right financial advisory services so that the households that really want to increase their income level, they can invest in the right sectors, which are the high yield sectors, productive sectors, and also how to manage their assets in the right way. So I think there we have a huge role to play in future so that our clients can take the best financial decision for their household. Thank you. Yeah.
Great. Thank you so much, Sandra. Like, I totally agree with you, is that, even in the urban setting, we do see that the village organization that we say at BRAC is where all the women, they come in a group, is dissolving, right? Because not because of digitization, because of the lifestyle, because of how things are at the moment. So definitely the group dynamics can be there, but as you said, that we really need to think about how our staff can be the agent who can actually advise them to how they should be spending their investment and do savings, and literate them more on that part.
Just to
um,
complement Moon, just to highlight this one point, it's like there has been a rising concern going on that these fundamental platforms of microfinance, what we say the groups,
mhm.
these fundamentals of groups is always being challenged. Like once we moved from lending to self-help group service, that point of saw a kind of transformation. Another transformation is going to be happen when we more and more digital
Digitized, yes.
interventions are going to come. So we have to keep these fundamental platforms alive. Otherwise, whole microfinance model will be at the question of, you know, existential will be arise. So we have to really think of how to make these platforms worth time spending for our clients by giving more financial advisory that is really meaningful for them.
It's thank you so much, Tanvir Bhai. But is anyone there who wants to share their experience from their organization? No, not yet. I hope as you know, like BRAC is huge, and microfinance has been working for more than 50 years now. So we have a lot of experiences that we wanted to share with you, especially in terms of digitization. So I think we just have few more minutes left in this breakout room. But before we go, just one last thought, Tanvir. Can you just give us just 1 or 2 points on how do we target better and how can we deliver more efficiently. If you can, let us know briefly.
Yeah, when we talk about target better, we have to really understand uh, what are the of the clients are changing, what are those needs are changing. If we do not on right insights of those clients, we cannot think about financial inclusion. If you see the situation of Bangladesh currently, in every economic indicator, in every social indicator, Bangladesh is progressing. But when we talk about integrated economic development, we saw there are many things to do. So in terms of targeting, there are COVID, there was an emergence of a new poor group that we have to really target on. In my opinion, the extreme poverty is going to increase, the poverty level is going to increase. So that's why we need to think about how to target in future years to really support those clients. Next, we see like a group of clients are coming up as a very young population, where we see like not many products are really fitting their needs. They're trying to start a business, they're trying to do some startup enterprises. But what when we look into our design, we see like most of these products are actually designed for established enterprises, established business, not for startups.
Startups.
So we have to really work on those areas, and innovative digital solutions are coming up. Many different private organizations are coming up with different group of clients. They're working with different group of clients, so we have to also think about how we can really partner with those organizations, and can think of different ways of you know uh, uh, getting those client insights about their behavior, about their financial transactions, about their needs, and design accordingly.
Okay. Thank you, Tanvi. I think we have one of the participants here, Mifta, who wants to share his thought. Mifta, are you there? We just have 1 more minute to go, so can you please raise your question or any thoughts that you want to share? Then we will move to the main session. We can't hear you. Shadat, how much time do we have at the moment?
Hi, Pa. Time's almost up, but if you want, we can take 30 more seconds to wrap it up.
I don't think he can hear us, even though he has raised his hand.
All right.
So I think we can move back to the main session. Thank you
Yes.
so much, Tanvi Bhai, for sharing your thoughts.
Thank you, Manu. Thank you, Zara.
Okay, we'll just move to the main session.
Thank you so much, everyone, for joining us today here in the breakout room. I would request you all to kindly join our main session, leaving the breakout room. It would be in your screen where you had been joining initially. Yeah, thank you so much for joining today.
Thank you, everyone.
From Bangladesh. I am Mahmouduz Zaman. I'm working in the Ultra Poor graduation program of BRAC. So it's good to be here and good to see you all. I will share about a little bit about my program later on when the discussion starts. Nice to meet you all. Thank you.
Hello, good evening to all. Can you hear me? Thank you. I am SK Mojibul Haq. I am working in BRAC Urban Development Program. Basically, I am working in BRAC from 1990, 31 years in BRAC. Started in BRAC and maybe ending will be in the BRAC. So thank you, everyone. Thank you for everything.
Yeah, thank you so much, Bhai. Raya, again, in the first part of the session, she has certain difficulties. She is to be the moderator or facilitator of this panel, but I will kickstart the discussion here anyways. I wanted to maybe the best way to kickstart would be to maybe I'll start from Zaman Bhai. Around my question would be around to understand or explain to the to the members here about what new challenge, what new program activities that your program had to conduct during the COVID-19 that wasn't previously done or tested, or maybe that you tested earlier but have not piloted in scale, that focuses around digital and then also digital financial services, and that has an financial inclusion element. So if you can share that experience with us, and then I'll hand it over to Mozibul Bhai. Over to you, Bhai.
Yes, thank you very much. Before I jump into the discussion about what we have learned, let me thank the Center for Financial Inclusion to invite me here to share our experience. So the program I work in, the Ultra Poor Graduation Program or UPG program, is recognized worldwide as the pioneer of the graduation approach and acclaimed for its innovative and holistic solution to poverty. BRAC's graduation approach is a comprehensive, time-bound, integrated, and sequenced set of interventions that aim to enable the ultra-poor household who are vulnerable and socially disconnected group to achieve key milestones towards sustainable livelihoods and socio-economic resilience. In order to progress along a pathway out of extreme poverty, the interventions enable the program participants to achieve sustainable livelihood through income-generating activities, connect them with the social safety net program of the government, and integrate them socially via a committee of elite and influential persons. Since it began in 2002 to December 2020, the program has served more than 2.1 million ultra-poor households in Bangladesh. During the pandemic situation, the program was heavily involved in the emergency response. As part of food stipend and emergency support from BRAC and the participants and other partners of the organizations, the program distributed the program participants. Apart from that, the program mobilized local resources via the Social Solidarity Committee to support the participants. While the pandemic was unfolding, the majority of cash transfer have been through door-to-door visits, but later on, this was not an option due to strict lockdowns. Moreover, movement during COVID-19 presents a risk to the staff and the participant as well. Also, at the initial stage, there was another aspect, that is social stigma associated with receiving relief directly from hand to hand. People were not comfortable to share their falling economic condition. To overcome these challenges, BRAC has piloted and scaled up the digital cash transfer using bKash, BRAC Bank's mobile money platform. At the same time, the program helped the distribution of the government's emergency support via mobile money transfer by providing wallet numbers of ultra-poor participants to the relevant officers of the government. This resulted in effective, efficient, and timely distribution of cash support to the targeted group. This has also ensured increased safety for the program staff and the recipients. The other advantage of support being provided remotely was that the neighborhood does not notice that the support is being channeled to someone. In 2021 alone, the Ultra-Poor Graduation Program distributed support to more than 73,000 program participants, and all this through mobile money transfer. Another thing happened. From this experience of emergency support, the program has started a pilot to understand how this mobile money transfer can be tailored for the ultra-poor participants to implement program activities of interest-free loans, installment, and savings collection. With this intent, the program is currently implementing mobile financial services for installment and savings collection in 36 districts of Bangladesh with nearly 9,000 participants. Necessary training and demonstration was provided to the participants for financial transactions, specifically for the payments of the program. The result is encouraging. More than 50% of the participants adopted the mobile money option to deposit their savings and installment. This has also resulted in the reduction of staff time spent for the collection of the same. So I would stop here and let other speakers to share their experience on that. So COVID has provided us this situation actually prompted us to adopt this mobile money system to disburse and also collect cash. Thank you so much.
Thank you. Over to you, Mojibul.
Thank you, and good evening from Bangladesh. So the Mahmoud Jaman Bhai already mentioned something, but I need to introduce some arena of urban development program first. The BRAC Urban Development Program has been working since 2016 with urban low-income communities to make a change in their life and livelihood through its different interventions. One of the intervention is financial inclusion service, and by using modern technology for poor, ultra-poor, formal and non-formal ready-made garments workers also involved in our program. So one technology within the COVID situation we have used that called building block technology by the support of WFP, World Food Program, and that technology for poor and poor household of low-income communities in Dhaka. So it is easy and a process of transfer cash through mobile banking. And another one is the ensuring nutritious food among the beneficiaries from a selected shop by using a QR code. So two things is measured here, and there is a process here, and the beneficiaries get their benefits or money, cash through mobile banking, and then they use their money uh, through a card and QR code used in the shop without cashless transaction happened here. And the measurement is going on whether they are getting the nutritious food or not getting the nutritious food. So it's a way to measure them through this technology, and this technology helps them to other way, that is if they get the nutritious food 2000 taka per month, and then they will get the cash back also 20% when they get this food, sufficient food, taking the sufficient from the shop. During COVID-19, cash and grant were transferred to formal and non-formal RMG workers and other beneficiaries by using mobile banking service. It's easier. And another thing is the installment of deposit premium scheme and health insurance premium also we have collected from the beneficiaries. That is the RMG workers. That's also a pilot project, and that's we have get through mobile banking systems. And the benefit we see that in financial inclusion service, technology is very much important to reach beneficiary because it is easy to access, not always time bound, hassle free from handling cash, and free from middleman fraudness. Distance is not a matter. Real beneficiary have got his or her benefits, have got service sitting in his or her own place. So it's easier for them and easier to use. How can technology be designed? If I can say, the easy to access, customized technology product need for the beneficiaries, not only app based, but find out other way of reaching out them. Only app is not sufficient for the poor and ultra poor and the RMG workers also. The lower educated person is not always easy with them. Migration is a big issue in urban setup. So an unique database with a unique ID need to introduce to trace the beneficiaries wherever they live. So it's need a big technology, big process, and big issue here. So it's needs to involvement of policymakers also. So policymakers involvement is with the technology upgradation unit is very much essential in this case. So and another thing, we have to train up the beneficiaries to use the technology also. That's all from my end, and
Yeah.
thank you.
Thank you so much, Bhai. Just for the audience, we put in a poll on the side asking how many. We understand that in the pace of technology is quite high, and then organization use different solutions, like multiple different solutions at a time around financial inclusion, and that has been one of the new things that we've also seen as a trend. It's not one by one, but four parallelly. There's a lot of learning happening parallelly as well. That's one takeaway. And then, so if you can answer those in the poll, that would be great. I would like to also then go into kind of synthesizing some of the what the speakers have said for my side of things. With BRAC is, last year we were very proud to be able to gather, we as a staff members at BRAC also contributed collectively crowdfunded funding for the beneficiaries, the poor, the ultra poor that we have identified. And then we also new private sector partners like Unilever and Grameenphone and others to provide services to more than a million direct cash transfers that was done collectively. And in that situation, most of it was done through digital financial services. This probably would be a very short period of time one of the fastest transfer of digital use of digital financial services for a cash transfer program in the world. In the humanitarian context, and this is something to be very proud of as an organization. What that also brings out is certain things like where the fund was brought in. This was a funding that was brought in within the BRAC employees, but also from the private sector. This is, and unlike the traditional programs where we bring in money from the development sector and donors, and then channel it through our system. Private donors as well are very peculiar about where the money goes and where who gets the money and what, right? A traditional monitoring and evaluation report would not be sufficient. It would be too complicated as well for a normal person who just donated to BRAC to support the ultra poor to be able to quickly understand where the money is going. And I think this is where new hyper transparency and accountability systems that allow transparency and accountability will work really well, and also will help reach out to the new poor, and not just reach out to the new poor, but also bring in new people who want to come in and help organizations like BRAC to fulfill its services. And going into that transparency and accountability side, Muzibul Bhai talked about building blocks. And building blocks is a solution that WFP has worked in the humanitarian response side. It is based on blockchain technology and uses the technology of blockchain to kind of provide transparency and accountability to the donors as well as to the many other stakeholders to show where the food distribution is going, how much it is going where, and where it was going. This was initially, I think, it was initially piloted in the humanitarian response side, in Jordan, and it's been brought into Bangladesh. Now it almost takes about 98% of all the general food distribution in Cox's Bazar, and be able to help and facilitate this some sort of discussion with UDP and WFP and the social, and initially in the initial part with the Social Innovation Lab to bring in building blocks into this conversation and bringing it outside of the humanitarian response side, traditional development sector during the crisis period. And it has been a wonderful success as has been mentioned. And in a way also This shows the potential of bringing new humanitarian innovations that previously development sector agencies would not think that, okay, this is not long lasting big situation. This is for a crisis response, and we do not deal with crisis responses. But this has shown that how innovations in the humanitarian space can also be brought in into development sector and used and to be used efficiently to create efficiencies in the system as well. I would go into a next question around, like, okay, we've told a lot of things that has worked, but what hasn't worked, and what I think we should maybe think about as we go into the frontier technology, and as we start using more transparent, open, efficient solutions. What do we need? What are the challenges that we're currently to think about in the future? Mozibul Bhai hinted that for a little bit, but maybe I'll start with Mahmoud Zaman Bhai and then going to Mozibul Bhai.
Yes, thank you, Kuldeep, and thank you, Muzibul Haq Bhai. In fact, I talked about the emergency response through mobile money transfer. That was very highly effective, and it was you can anticipate that it goes to the participant directly. But with this kind of technology, one thing is of concern in very few cases. I mean, in our case, 95% participants received the money and could use it properly. In few cases where the device ownership is with a family member or someone in the neighborhood, in those cases there was a slight delay in the process. The other thing is the literacy of the participants. As we are talking about the ultra poor households and participants, because of their low literacy rate, sometimes they couldn't understand that they have received a cash transfer through their mobile services. And as I have mentioned, that we have started collecting our installments and savings via the mobile money technology. There also literacy plays a role, and because their literacy rate is low there, the money transfer process took quite some time for them to master, and we had to also coach them and demonstrate them well so that they are able to independently transfer the money. And sometimes the other thing is that the sending process, there is a PIN number for sending. Sometimes they forget the PIN number, and that creates some trouble. So for me to looking at the future, the simplification of this transaction process, and also the creating awareness across these stakeholders is very important. And also increasing the breadth of this mobile money economy or ecosystem will also help in the future.
Yes, I think a lot of the time what has happened is that we introduce digital services, but they become a hurdle to pass rather than sometimes becoming the easy way for beneficiaries to interact. And I think the end service, how beneficiaries interact with digital services, needs a lot of improvement. Technology has caught up, but the front end user service and user design has to yet caught up. Absolutely. Has to catch up to the users. Mozibul Bhai, just final thoughts on it.
Just a few points from my end. That is, the Mahmoud Jaman Bhai already mentioned that when we go for a cash transfer for formal RMG workers, they are basically underage, and they have not basically some mobile money registration. So they have got some money from other source, from other places. That's to make a problem there. That is, to get the cash from hand. It's make some time delay, or sometimes disagreement comes, and then when we go for physically visit and then agree that this is happened, so I have got the money. So this has happened. And another, in case of mobile money, mobile accounts, financial Bikash account or others, there is some documents needed, which is not available always with the beneficiaries. They have not, that is, if we say that the RMG workers, they have not the NID card always, because they come from the village and they're working in here. So when they go for mobile mobile money account, then they need the NID card, and that's not provided by them. So it's a make a problem. And there are some other technological problems also happened when they that mentioned by the Mahmouduzzaman Bhai, and also they using this and a timing factor to make a Bikash account, that is account may be sometimes delayed or some problem arises. Such type of and using is also a big problem. And another one point I can mention, that is if they need to use the data, so the ultra poor and others, they do not have available money to buy data. That's also a problem for them.
I would like to pick on specifically on the issue of documentation and ID. You mentioned the need for unique ID systems for beneficiaries. I think beyond the nationally created NID systems, NID system which at times do not help us to capture the beneficiaries below 18 years old, and also the marginalized who are undocumented. I think a use of potentially new sort of alternative means of verification and identification are very important. And again, going back to what the frontier technology side of it, I think instead of creating these new ID systems, blockchain as a solution is a really important technology coming in the next decade to help us provide identities to the people who do not currently have identities yet, and provide an alternative source of identity that where the control of the personhood as well as the digital identity goes to the beneficiary. And I think that again links to how, if we use a decentralized ID system that allows a lot less encroachment by authorities, and a lot more connectiveness in terms of how creating multi-token wallet systems with the ID system, meaning you could then do financial transfer, you could do commodity transfer for the kind of projects that was mentioned around nutrition. You could trace and identify the migrants, where they went, and all of this can happen where beneficiaries have the ownership of the data that they have. And I think the potential of using too much data right now is that it can go into the negative side, where too much data collection is happening and beneficiary loses the agency. And I think a big part of it is about bringing back the agency to the beneficiary again, and allowing the beneficiaries to understand data better, and a lot of that can only happen through digital literacy and digital financial literacy. Raya, any final thoughts from you on this? No, I think Raya still has trouble. Any questions in the chat room?
But I think we need to go back to the other room,
okay,
room
all right.
just to get that started. Thank you so much, everyone.
Okay. Thank you.
Okay, so I think we have everyone in the main session. So we're at the very last part of our webinar today. Thank you very much, everyone who participated in the breakout rooms, and thank you especially to our speakers. So we have heard from our experts in the breakout sessions. So I would just briefly conclude what we discussed in the breakout rooms, just for everyone to be on the same page. So in breakout room 1, we heard how financial inclusion might help strengthen our work in the last mile health service delivery, skills development, and education. So we need to develop skills among youth, promote entrepreneurship through digital and financial literacy and trainings, and offer financial products to the youth so that this can help them invest in generating earnings. And in education, we have seen that digitized payments help BRAC and teachers reduce students' learning loss during the pandemic. So to make the sector more resilient to future challenges, we need to equip our teachers with flexible tools to enable teaching and learning from anywhere. And on the health side, volunteers are significant frontline responders at community level and globally, often outside of formal payrolls. Financial inclusion of community health volunteers, who are especially women, can help them become micro entrepreneurs who earn a living while also filling essential gaps in health service delivery at the last mile. So, additionally, digitizing health worker payment gives us essential data on support and service gaps that simply don't exist right now. So on the other session, where on Future for Financial Health and Inclusion, we learned and talked about that working with clients closely in vulnerable situations can make both clients and the organization resilient. So we have to adapt to situations and provide customized products and services to benefit our clients rather than thinking of one size fits all. It is evident that digitization will lead to more financial inclusion, and we do need to think about, you know, due to digitization, how group dynamics will work in terms of maintaining financial discipline. Also, for long term, rather than being a mere agent of financial transactions, we have to turn to be the agent of financial advisors so that their wealth is better managed and their investments are rightly used. And lastly, in the session on targeting new challenges with frontier technology in financial inclusion, the discussion was more on the line of current barriers to access that the ultra poor or urban poor are facing, and how future technologies must be built to supersede that. Financial inclusion can help bridge the gap by weaving in some digital literacy, but there must be more radical ways to design technology that doesn't rely on stringent literacy expectations. So both the ultra poor and the urban poor are changing, as we discussed in one of the sessions, and as are their challenges. In urban, BRAC is planning to introduce legal and health services for RMG workers, and all this could benefit from being tied in with financial services. There are important lessons on financial inclusion and integration of technology to provide greater transparency and responsiveness. That can be drawn from humanitarian response, and these lessons should be extended to regular programming as well. So we have started working towards that end at BRAC. I think so. As we have approached at the very end of our webinar, I would like to thank the speakers who joined our today's sessions, and organizers and the audience. So have a good financial inclusion week. Goodbye and stay well. Thank you.